Staggering numbers from the Denver Medical Examiner's Office, the most drug overdose deaths in Denver County ever recorded. Preliminary numbers show 522 overdose deaths in 2023, and that's more than double what we saw just 5 years ago. More than half of the overdose deaths last year were fentanyl related. So taking this further tonight, overdose deaths are also rising in Denver's unhoused community. Nearly 3 out of 4 deaths among people experiencing homelessness were caused by a drug overdose last year. And the medical examiner says these numbers are preliminary and they may actually be higher. So tonight we're taking a look at a new mobile health unit bringing methadone treatment where people in Denver need it most. The Denver Health Initiative is the first of its kind in Colorado. And Denver 7's Colette Bordelon explains how it works and who it serves.
Since 1966, Denver Health's East Side Clinic has cared for Coloradans.
The oldest federally qualified health center this side of the Mississippi.
The historic health center has a new addition.
It was a ripe place to do it.
An addition on wheels.
They usually call me the patient, but I just go with whatever.
Serving people like Jessica Pitzer, who goes by Jess.
I'm totally blind.
She and her service dog only have to travel a few minutes to get here.
I actually don't have eyes anymore. I was born with glaucoma, and after 81 surgeries, they decided to go ahead and remove them because they just couldn't control it anymore.
Living with chronic pain, Pitzer was prescribed opioids before.
Some of them worked, but they don't want to prescribe some of those things long term because it's not safe. Dr. Pytel suggested that we try methadone.
Methadone is an opioid. It's a long-acting opioid, so meaning that a person only needs to take it one time a day and they can feel good for 24 hours.
That's Pitzer's doctor, Jarrett Pytel.
There's often an overlap for many people with opioid use disorder that chronic pain is a contributor.
He says the mobile opioid medication-assisted treatment, called the MOMAT unit, is an extension of Denver Health's opioid treatment program on their main campus, allowing methadone to be dispensed outside the East Side Clinic, something that's not possible inside.
I can prescribe methadone for pain, and they can get it at the pharmacy. But methadone for opioid use disorders, it's a whole other regulatory framework. If I wanted to treat them with methadone, a patient with opioid use disorder with methadone, I was not able to do it. Though I'm a board certified specialist, federal regulations would not allow it.
The locations picked for the MOMAT at both the East Side and West Side clinics were intentional.
Data as far as what locations are we getting most of our clientele from our main campus.
Maggie Buick is an addiction counselor for the MOMAT unit, which officially launched in the fall of last year.
This is the first one in Colorado.
Methadone treats opioid withdrawals while curbing cravings.
Helps get rid of those barriers that traditionally come up and can kind of deter people from starting treatment.
It's a really innovative approach to integrating addiction treatment into the context of primary care.
And for Pitzer, a daily dose.
There we go.
Has changed her life.
I'm more awake. I'm able to be more active. I'm able to work more and do more things, and it's been a lot for me. It's been nice.
Colette Bordelon, Denver 7.
And the MOMAT unit is funded through a 2-year grant. Alongside methadone treatment, it provides patients with behavioral health and peer support services.